Good afternoon, and thanks for joining us for Living Local, your lifestyle show for all things Charleston and beyond. I'm Ashley Meservey.
Medical Monday, sponsored by East Cooper Medical Center.
Joining us today, we have Dr. Stephen Poletti. He's a spine surgeon here at East Cooper Medical Center. Thanks so much for joining us.
Thank you.
Okay, let's talk about the most common causes for spine and back pain in general.
Well, the most common cause of back pain is a muscular strain, and so all of us have tweaked our backs and felt pain and spasm. Usually that goes away after a couple of days of rest. What the most common cause of back problems that we'll see at Southeastern Spine Institute and here at East Cooper are people who have problems with their discs. So the discs are the cushions between the bones, and when they slip or rupture, they can press against the nerves. A lot of people have had sciatica, which is pain that runs down the leg. And so if a disc pushes against the nerve, it gives you sciatica, and that's probably the most likely or common thing that we see in the Institute.
And you're seeing people from all walks of life, all age range. You know, it's not like you're old and you start having back problems. I know mine started, years of playing soccer and things like that. So, I mean, are you seeing a lot more of high school athletes and things like that?
Some. Again, most of us develop back problems when we're starting to fall apart a little bit, and so it's typically more prevalent in people beginning in your 40s and gets gradually worse as you get older. But you're exactly right. There are people that we see that are even in their teens that have a curvature in their spine or have something that they were born with that continues to get worse as they get older.
Because what's it called? Degenerative disc?
Right. Degenerative disc disease
There we go.
is the cushions in our back gradually wearing out. All of us will get degenerative disc disease, and so it's almost like getting gray hair. It's something that none of us are going to avoid, and that's the process where the cushions between the vertebra wear out and the bones start rubbing together. And I think all of us who are getting older feel creaky sometimes, feel our bones actually rubbing together, feel what we call in medicine crepitus, which is that snap, crackle, and pop feel that you get when you move your neck or your knee and you hear the bones rubbing against each other.
And of course, staying active and keeping a good weight and things like that can kind of help make it to where it doesn't complicate it even more as we age, right?
Right, using your core to strengthen the muscles up around your spine is key to keep the pressure off of the discs. We've also found, like so many diseases it affects, that cigarette smoking contributes to disc degeneration. And so watching your weight, keeping your core strong, and staying away from smoking are sort of the three keys to avoiding serious back problems.
Alrighty, well, thank you again for all the knowledge you're sharing with us today. We appreciate it.
Thank
and
you.
for more information, you can head online to eastcoopermedctr.com.